Junior medical professionals signed contracts last year with the Northern Cape Department of Health. However, the department didn't keep their promise. In January this year, the doctors' housing allowance was stopped, amongst others.
We received the allowances for 2020, but not as of January 2021. The other concerns are also the overtime hours that we're currently working, where we are averaging 127 hours of overtime and only being compensated for 80. We are not here asking for more money. We are just asking them to commit to the agreement that we made and the contract that we signed.
Despite a settlement agreement in January, they are still in limbo. The medical professionals remain at the forefront of the deadly COVID-19 pandemic.
We're just going to continue doing our work because, again, as I said, we can't let patients' health and everything fall just because we are unhappy doing so. Unfortunately, I think in most places in South Africa, the public health system is failing and most doctors are frustrated and unhappy, and you don't have resources to treat someone.
The former acting head of the Provincial Health Department, Dr. Dion Thuys, who is currently on precautionary suspension for allegedly awarding PPE procurement contracts worth 43 million rand without proper procedure, met with the South African Medical Association last year on the matter.
Know that then acting HOD was Dr. Thuys. We did also communicated last year with him, and we don't know, what happened to these monies. As we all know, that there is investigations into corruption. So I don't know. So it's extremely difficult.
The Northern Cape Department of Health says all their operations are above board, but will engage affected stakeholders.
We can confirm that subsequent to DPSA extending timeframes for utilization of leave days from June to December this year, the hospital management facilitated internal consultation to ensure that no employee forfeits his or her leave days. With regards to allegation of our doctors not being paid overtime, we must first note that overtime is paid according to the number of extra hours worked, and a submission is compiled and approved to that effect by the department. For healthcare professionals on a salary package, they need to structure their housing allowance as part of their non-pensionable allowance, and the department will further consult with them on this matter. I thank you.
The South African Medical Association has called for action and accountability.
And then you have to start all over again with the process, and you need to make sure that there is definitely this time accountability, and that all the parties sit around the table. Some are more than willing to sit around the table with Northern Cape Department of Health, as well as the management of the hospital, as well as the aggrieved interns and community serve.
The doctors say if they are forced to file for litigation, they'll proceed, a process they would want to avoid at all cost. Reginald Witbooi, SABC News, Kimberley.